informing, educating, and just doing all-around good work. Now, today we're looking at Mom Connect, which is a groundbreaking digital health initiative by Reach Digital Health that provides pregnant women with prenatal, during, and postnatal information, and prioritizes maternal and child health using mobile phones. In partnership with the South African Department of Health, the Mom Connect offers free services in all of South Africa's 11 official languages and aims to improve pregnant women and infants' health. Participation is voluntary, and pregnant women can actually stop receiving messages anytime should they wish to. Mom Connect is designed to help reduce maternal and child death by providing important health information and feedback. And we are now joined on the line, on a streaming line, by CEO of Reach Digital Health, Debbie Rogers. Good morning, Debbie.
Good morning. How are you?
I'm great. How's Sunday going?
Very well, thank you.
That's good to know. So I want to find out what need did Reach Digital Health notice that motivated them to start this initiative?
I think the big need is that we noticed that health facilities are overloaded. And this isn't just a problem in South Africa. This is a problem across the world. But for example, in sub-Saharan Africa, we have 11% of the world's population, 25% of the world's disease burden, and only 6% of the world's health workers. We're completely overwhelmed at facilities. And so women who might be going for their antenatal visits only get a few minutes with the nurses in order to ask them questions or find out any information they might want to find out. So rather than burdening the health system more, what if a mother could access all this information she needed just on her mobile phone in the comfort of her own home?
And how did you get the Department of Health on board?
Well, they've been really, right from the beginning, leading the charge. They wanted to be able to have a program that would address maternal and child mortality. They wanted it to be digital, and they called all the organizations together who had been doing work like this. And Reach had a previous program called Ask Mama. And we adapted that to work for the National Department of Health. So it's really been spearheaded by the National Department of Health right from the beginning.
I mean, pregnancy is a big thing in a woman's life, and it literally changes your life forever. How much information does the average woman have about, this period of their life?
Look, it does depend on the woman and how much she's been exposed to things. But generally, it's a very new thing for most people, no matter how educated you are or how much access you have to internet. This is a time of great discovery, right? And I think it's also a time when you get exposed to a lot of misinformation. So, your cousin might be telling you something, your mom might be telling you something, your friend might be telling you something. How do you even know if any of that information is worthwhile information, if it's the correct information?
Yeah.
And so we don't just need a source of information, we need a trusted source of information at that time.
Absolutely true. And so this is throughout, it's during pregnancy and after the baby is born. And how do you continue that? Is it after toddler stage, or is it just early days of once the baby is born?
At the moment, Mom Connect goes from just when you find out you're pregnant, all the way through your pregnancy, over the birth period, and then up until your baby is 2 years old. And those are really the critical years for infant and maternal mortality. And ultimately, what we're trying to do is we're trying to improve infant and maternal health, prevent deaths, prevent illness. And so that's why we focused over that period of time. Interestingly enough, Mom Connect is what we call stage-based messaging. So when you're 9 weeks pregnant, you get the messaging that's appropriate for being 9 weeks pregnant. When you have a 2-year-old, you're getting the messaging that's appropriate for a 2-year-old. And so we're actually walking you through that journey and holding your hand right from the beginning up until the baby is now a toddler.
How does it work? I do have to subscribe to the app, or it's like an SMS subscription where I get notifications, or I can just go onto the website and just ask a question, or maybe check the frequently asked questions that way?
A good question. So what we realized right in the beginning is that not everybody has access to a mobile phone that can download an app. And if you download an app, it's going to take up a lot of space on your phone. But what everybody has is either the ability to send an SMS or receive an SMS, or the ability to send or receive a WhatsApp. And so we offer Mom Connect via SMS and via WhatsApp. And what happens is we send out these stage-based messaging. You can sign up at any clinic, in any public clinic in South Africa. And you receive messaging throughout your pregnancy and up until the baby is 2, as I mentioned. But it's also two-way. So it's not just about sending you messages and hoping for the best. You can ask questions, you can engage with the content, you can speak to a help desk operator. And we use a lot of AI to automate that process. So we really just engage in a chat like you would with anybody that you're having a chat with over WhatsApp. You can chat with Mom Connect.
And how does this ultimately then impact the lives of women?
So we've been measuring the impact of Mom Connect for a while now, and we know there are a number of different ways that this improves maternal and child health. So one of the big ones is that it encourages women to go to all of their antenatal visits, all of their visits to the clinic during their pregnancy. Mm-hmm. This is critical because it allows people to be able to pick up if there is any issues with the pregnancy, if there's any high risk that women need to be aware of. We also find that people are more likely to go to their postnatal visits, so more likely to go to their visits after the baby has been born. They're more likely to get their children vaccinated, which is absolutely critical for child health. They're more likely to take up breastfeeding, so more likely to breastfeed their babies, particularly new moms. And they're more likely to take up family planning after birth. And we know from many, many years of research that if we are able to achieve these few things, we will reduce the maternal and child mortality in a country. So we've seen really big impact with this program.
Yeah. All right, we're going to end our conversation here. Thank you so much for joining us this morning, Debbie. And are you guys on social media?
We are. So you can find us on X, you can find us on LinkedIn, and you can find us on our website, www.reachdigitalhealth.org.
All right. Thank you so much once again. Have a fantastic day going forward.
Thanks, you too.
Okay, so that was CEO of Reach Digital Health, Debbie Rogers. Stay tuned to Channel Africa because we do have one more conversation in this hour. And what is that going to be? We're looking at the future of podcast networks. You saw Ms. McGee also did the reshuffling. I'm like, hey, look at you guys growing over there. I'm also wondering, like, how do you conclude? Or how do you say, well, I think this one will make a very good podcast person? Is it the following? Is it the looks? I don't know. We're going to talk about that in a short while. It is now 10:30. Oh, it's 10:30 Central African time. Let's take a break.
Keep Africa in your hands. Connect to our website for all your news, sports, and cultural updates. channelafrica.co.